So hello students. Hello students. Am I audible? So hello students. Am I audible? Just one moment. Okay. Am I audible to all of you? Right. Hello students. Just one,
In 2023,
one moment. I'm just coming on the screen. Hello to all of you. Hello. Hello to all of you. So good evening. Good evening to all of you. Am I audible to all of you? Hello. So let us start. Okay, let us begin with the first MCQ. Okay. Hello. Good evening to all of you. We'll start. We'll start with the first MCQ. Have a look. So flexion and medial rotation of arm is done by which of the following muscles? Students, come on, answer this. Be interactive. So let us discuss things. Be interactive. So flexion and medial rotation of the arm is done by which muscle? Come on, you answer. You answer. Then we'll discuss. Option A: trapezius, deltoid, serratus anterior, and pectoralis minor. So flexion and medial rotation of arm is done by, yes, the deltoid, anterior fibers of deltoid. Whereas students, deltoid has got three types of fibers. Come on, let us now discuss things. Whatever you know, you tell me. What is this muscle now? This is the deltoid. Deltoid को तीन type of fibers होते हैं. There are three types of fibers. One, this are the anterior fibers. What are these fibers? Acromial fibers, and the one behind are the posterior fibers. ठीक है ना? Anterior fibers, acromial fibers, and posterior fibers. What is the action of anterior fibers of deltoid? Students, can you answer this? So deltoid has got three types of fibers. Let me just write this down for you. Deltoid has got three types of fibers. One is anterior, one is acromial, and the other one is posterior. Action of anterior fibers of deltoid is flexion and medial rotation. Flexion and medial rotation at the shoulder joint. The posterior fibers of deltoid do what? They do extension and lateral rotation. Extension and lateral rotation. And what is the acromial fibers of deltoid do? Students, come on. Jitna discuss kar sakte hain, let us discuss. Okay, so many MCQs, many options will become clear. What does the acromial fibers of deltoid do? Any guesses? Answer this. Acromial fibers of deltoid. They cause abduction. Very good. They cause abduction from 15 to 90 degrees. 15 to 90 degrees of abduction is done by acromial fibers of deltoid. Okay, this is abduction from 15 to 90 degrees. Can anyone tell me who does 0 to 15 degrees of abduction? 0 to 15 degrees of abduction is done by whom? Any guesses? Who initiates abduction? ये MCQ आता है. MCQ. Initiation of abduction is done by. Yes, students, answer. You must be well prepared now. Come on, answer. Initiation of abduction is done by which muscle? Even if it is wrong, it's okay. I'm here to correct you. Bolo bachcho. Initiation of abduction is done by supraspinatus. Very good. That's supraspinatus. So 0 to 15 degrees of abduction kaun karega? Supraspinatus. 15 to 90 degrees of abduction is done by deltoid, acromial fibers of deltoid, and 90 and above. Yes, what do you call this as? Overhead abduction. And ye overhead abduction kaun karega? Who will do this? Serratus anterior and trapezius. Serratus anterior and trapezius. Perfect. Okay. So that's about abduction at the shoulder joint. Right. Can anyone tell me what is the nerve supply of trapezius? Nerve supply of trapezius. Anyone? Come on, answer. Be interactive, students. Keep on answering, so it will be easy to understand. And बहुत MCQs clear हो जाएंगे in this session. Flexion. What is the action of trapezius? Sorry, action of trapezius. What is the nerve supply of trapezius? Yes, nerve supply is the spinal accessory nerve. Spinal accessory nerve. And what is the action of trapezius, students? The action of trapezius is overhead abduction. Second action of trapezius is shrugging of shoulders. And there's one more action. एक और action है trapezius का, which was asked in this PG NEET. What is that action of trapezius? एक है shrugging of shoulders. Second is overhead abduction of arm along with serratus anterior. Which is the third action of trapezius? Any guesses? This was the MCQ asked in INICET. ये अभी जो हुआ ना INICET, उसमें पूछा था ये. What is the third action of trapezius? Trapezius along with rhomboids. Chalo, I'm giving you a hint. Trapezius along with rhomboids do what? Yes, bachcho bolo. Come on, answer. Trapezius along with rhomboids do. Yes, very good, surgeon. Yes, retraction of scapula. Yes, very good. That's retraction of scapula. Trapezius along with rhomboids. ठीक है? ये करता है retraction. This was the MCQ asked in this INICET, which was held on Sunday. What is the action of serratus anterior? अब retraction कौन करता है? Trapezius and rhomboid. So what is the action of serratus anterior? Students, serratus anterior takes the scapula outwards. इसका action क्या है? Protraction. Protraction of scapula. Protraction. The scapula goes outwards, and this protraction is very commonly seen in whom? Boxers. So serratus anterior is also known as boxer's muscle. ठीक है? Serratus anterior is known as boxer's muscle. ये सब MCQs हैं बच्चों. This is very important MCQ. And paralysis of serratus anterior results in what? Winging of scapula. ये आपको पता है. Paralysis of serratus anterior results in winging of scapula. Perfect. Can anyone tell me what is the nerve supply of pectoralis minor? Nerve supply of pectoralis minor. Any guesses, students? What is the nerve supply of pectoralis minor? It's the medial and lateral pectoral nerves. Medial and lateral pectoral nerve. That's the nerve supply of pectoralis minor, the medial and lateral pectoral nerves. Right? And out of this two, medial and lateral pectoral nerve, which nerve is going to pierce the pectoralis minor? Any guesses, students? Which is the nerve which is going to pierce the pectoralis minor? That's the medial pectoral nerve. ये याद रखना, that's a very important MCQ. The medial pectoral nerve is going to pierce the pectoralis minor. Okay. So nerve piercing the pectoralis minor is medial pectoral nerve. ये याद रखना. हाँ. फिर lateral pectoral nerve क्या pierce करेगा? If the medial pectoral nerve is piercing the pectoralis minor, what is the lateral pectoral nerve going to pierce? Chalo, bolo bachcho. What is the lateral pectoral nerve going to pierce? Any guesses? The lateral pectoral nerve is going to pierce the clavipectoral fascia. Clavipectoral fascia. याद है ना clavipectoral fascia? आपको याद है ना? Yes, clavipectoral fascia is pierced by 4 structures. There are 4 structures which pierce the clavipectoral fascia. 1, the cephalic vein. 2nd, thoracoacromial artery. 3rd, the lateral pectoral nerve. And 4th, lymphatics from the breast. Lymphatics from the breast. So structures piercing the clavipectoral fascia. Another very important MCQ. बच्चों याद रखना. Cephalic vein, thoracoacromial artery, lateral pectoral nerve, and lymphatics from the breast. Perfect. Clear to all of you? We'll proceed. Are you able to follow this? Okay, come on. Going to the next MCQ. Answer this, students. A 40-year-old male complains of tingling and numbness along the lateral aspect of the forearm. The nerve affected is a branch of. Answer this. Yes. Come on, students. The nerve affected is a branch of. Any guesses? Musculocutaneous nerve. Yes, very good. That's the musculocutaneous nerve. What is the nerve? What is the continuation of musculocutaneous? In other words, एक बोल सकते हो आप, what is the musculocutaneous nerve supply? ये कौन से muscle supply करता है? 1 is the biceps brachii, 2nd is the coracobrachialis, and 3rd is the brachialis. Brachialis, which half? Medial half. Medial half. So what are the muscles supplied by musculocutaneous nerve? The biceps brachii, the coracobrachialis, and the brachialis. And what is the cutaneous branch of musculocutaneous nerve known as? The lateral cutaneous nerve of forearm. Lateral cutaneous nerve of forearm. ठीक है ना? Can anyone tell me the root value of musculocutaneous nerve? Yes, बच्चों बोलो root value of musculocutaneous nerve. Very good, very good. You're answering very well. Biju. Yes, surgeon, very good. Ped psycho, very nice. चलो keep on answering बच्चों, keep on answering. अच्छा revision हो जाएगा आपका, refreshing हो जाएगा. The entire topics will refresh and brush. चलो बोलो, what is the root value of musculocutaneous nerve? Keep on answering, keep on answering, keep on typing. You know things now. Root value of musculocutaneous nerve क्या होगा? C5, C6 and C7 है ना बच्चों? C5, C6, C7. And this musculocutaneous nerve is a branch of which cord of the brachial plexus? Lateral cord, right? Musculocutaneous nerve is a branch of lateral cord. Fine. Radial nerve का root value बताइए. Radial nerve का root value, all the roots C5 to T1. C5 to T1. Musculocutaneous nerve is C5, C6, C7 बच्चों. Radial nerve is C5 to T1. Axillary nerve is C5, C6. C5, C6. Okay, C5, C6 is axillary nerve. And what are the muscles supplied by axillary nerve? कोई बोल सकता है? The muscle supplied by axillary nerve is 1 deltoid. Deltoid. 2nd is teres minor. 1 is deltoid, 2nd is teres minor. And what is the cutaneous branch of axillary nerve? Cutaneous branch, उसका नाम है upper lateral, yes, upper lateral cutaneous nerve of arm. Upper lateral cutaneous nerve of arm. So what is the axillary nerve supply? It supplies the deltoid, it supplies the teres minor, and it gives a cutaneous branch जिसका नाम है upper lateral cutaneous nerve of arm. And injury to this nerve leads to what? Injury to this nerve leads to regimen batch sign. Regimen batch sign. Regimen batch sign. So injury to the upper lateral cutaneous nerve of arm, there's a loss of sensations here, and this is what we call as the regimen batch sign. Perfect. What is the root value of ulnar nerve? Bachcho, can anyone tell me what is the root value of ulnar nerve? Ulnar nerve is a branch of which cord of the brachial plexus? Come on, anyone? Guesses? Come on. Ulnar nerve is a branch of medial cord. Yes, very good. Ulnar nerve is a branch of medial cord. Medial cord का root value क्या होता है? C8 and T1 है ना. Medial cord का root value is C8 and T1. But what is the root value of ulnar nerve? Is it C8 and T1? Yes, बच्चों बोलो. Yes, very good. It's C7, C8 and T1. C7, C8 and T1. Ulnar nerve का root value है C7, C8 and T1. And this C7 fibers come from, C7 fibers arrives from, ये सब बहुत इंपॉर्टेंट एमसीक्यूज हैं, लैटरल कॉर्ड. लैटरल कॉर्ड, ठीक है. The C7 fibers they come from the lateral cord of the brachial plexus. देखो अल्नार नर्व का रूट वैल्यू C7, C8 and T1 and this C7 fibers they arise from the lateral cord of the brachial plexus. Perfect बच्चों, perfect, clear है. Okay, चलो let us proceed. Come on students, come on, if you can answer this MCQ. Which of the following is not a content of the carpal tunnel? Chalo, answer this. Which of the following is not a content of the carpal tunnel? Any guesses? A very important MCQ. Any guesses? Yes? Come on, answer this. बोलो बच्चों. See, flexor pollicis longus surgeon, nahi, you made a mistake. That's a mistake. No, it's not flexor pollicis longus. बच्चा, carpal tunnel, ये बहुत important MCQ है बच्चों. Try to revise, try to recollect things. अब ये carpal tunnel क्या होता है? What is this carpal tunnel? It's between the carpal bones and the flexor retinaculum. Correct? It's between the carpal bones and the flexor retinaculum. Let me draw the slide for you, children. Let me draw the slide. Look. These are the carpal bones. I'll just make it like this. These are the carpal bones here. And what is connecting the two ends of the carpal bones? That's the flexor retinaculum. This is medial and this is lateral. ये medial and lateral. Now this flexor retinaculum on the lateral side it divides into two slips. Yes, it split होता है. The flexor retinaculum divides into two slips. Okay, two slips. Now, what are the structures which pass through the carpal tunnel? Through the carpal tunnel, this is a tendon which goes to the thumb, a muscle which goes to the thumb. What is this known as? Flexor pollicis longus. And ये जो tendon है ना, this tendon of flexor pollicis longus, students, it is put in a synovial sheath. Can anyone tell me what is this synovial sheath known as? So this synovial sheath is known as the radial bursa. Radial bursa. So this is flexor pollicis longus with radial bursa. ये carpal tunnel है. This is a carpal tunnel. Where is the carpal tunnel? It's between the carpal bones and the flexor retinaculum. So that's the tendon of flexor pollicis longus with radial bursa. Okay. What are these four tendons of, bachcho? These are the four tendons of flexor digitorum superficialis. And these are the four tendons of flexor digitorum profundus. Flexor digitorum profundus. And again there is a synovial sheath. ये ऐसे होता है ना, which covers the tendon of flexor digitorum superficialis and profundus. What is this known as? इसे हम बोलते हैं ulnar bursa. Ulnar bursa. So flexor digitorum superficialis and flexor digitorum profundus with ulnar bursa. Ulnar bursa. Correct? And what is this nerve here? ये nerve क्या है? What is this nerve? The median nerve. That's a median nerve. That's a median nerve. So what are the structures which pass through the carpal tunnel? One is the tendon of flexor pollicis longus with radial bursa, the four tendons of superficialis and the four tendons of profundus with ulnar bursa and the median nerve. Median nerve. Clear? What is this tendon? Can anyone tell me ये क्या tendon है which is passing through the flexor retinaculum? The flexor retinaculum divides into two slips. And what is this tendon which passes through the flexor retinaculum? Yes, बच्चों बोल सकते हैं. What is this tendon? Any guesses which passes through the flexor retinaculum? This is the tendon of flexor carpi radialis. Flexor carpi radialis. No. It doesn't pass through the carpal tunnel. नहीं. It passes through the flexor retinaculum. ठीक है? Passes through the flexor retinaculum. अब बोलो बच्चों. What is this extension of flexor retinaculum known as? इसे क्या बोलते हैं? This is what we call as the volar carpal ligament. Volar carpal ligament. है ना? This is an extension of the flexor retinaculum on the medial side. And what do you call this as? The volar carpal ligament. And what is this tunnel here? This tunnel is known as the Guyon's tunnel. इसे हम बोलते हैं Guyon's tunnel. Guyon's tunnel. That's the Guyon's tunnel. And what passes through the Guyon's tunnel? The ulnar nerve and ulnar artery. Ulnar nerve and ulnar artery. So what are the structures which pass above the flexor retinaculum? This is the tendon of palmaris longus. क्या चाहिए बच्चा? What do you want? See, the flexor retinaculum on the lateral side it divides into two slips. है ना? ये देखो. On the lateral side it divides into two slips. What passes through this is the tendon of flexor carpi radialis. Similarly, bachcho, the flexor retinaculum gives an extension on the medial aspect. There's a small extension on the medial aspect. What is that known as? The volar carpal ligament. That's a volar carpal ligament. And between the volar carpal ligament and the flexor retinaculum, between the volar carpal ligament and the flexor retinaculum, जो tunnel बनता है, tunnel. What is this tunnel known as? The Guyon's tunnel. इसे हम बोलते हैं Guyon's tunnel. So what is Guyon's tunnel? It's between the flexor retinaculum and the volar carpal ligament. And what passes through the Guyon's tunnel? The ulnar nerve and ulnar artery. Ulnar nerve and ulnar artery. ठीक है बच्चों? अब clear है बच्चा? So this is one, and there's an artery here. I'll just write this down for you, bachcho. This is a very important MCQ. Structures passing above the flexor retinaculum. I'll just write this down. Structures passing above the flexor retinaculum. Structures passing above flexor retinaculum. Number one is ulnar nerve and ulnar nerve and artery. Ulnar nerve and artery. Number two क्या है? What is this number two? That's the palmar cutaneous branch of ulnar nerve. Palmar cutaneous branch of ulnar nerve. Number three, palmaris longus. Number four is palmar cutaneous branch of median nerve. Palmar cutaneous branch of median nerve. And number five is superficial palmar branch of radial artery. Superficial palmar branch of radial artery. Clear? Now clear to all of you? Perfect, bachcho, perfect now. Okay, so these are the structures which are passing above the flexor retinaculum. So now you answer this. Which of the following is not a content of carpal tunnel? Your answer is palmaris longus. Palmaris longus. Clear? So flexor digitum superficialis passes through the carpal tunnel. What is that bursa which encloses this flexor digitum superficialis? Uska naam hai ulnar bursa. Ulnar bursa. Flexor pollicis longus passes through the carpal tunnel. Uska bursa ka naam. What is the name of the bursa? Radial bursa. ठीक है? And the median nerve. And compression of this median nerve in the carpal tunnel is known as carpal tunnel syndrome. Right? This is the compression of median nerve in the carpal tunnel. The median nerve gets compressed here, and that is carpal tunnel syndrome. Perfect, bachcho? Clear to all of you? Okay. Chalo, we'll proceed to the next MCQ then. Floor of anatomical snuff box is formed by. Chalo, bachcho, if you can answer this. All clear? I'll just message you. Is everything clear to all of you? Any doubts? Please do ask. Okay. चलो बच्चों, floor of anatomical snuff box is formed by, any guesses there, any guesses? Okay, fine. I'll tell you one very easy way to understand the anatomical snuff box. Okay, we'll just make an anatomical snuff box for you. देखो बच्चों, कैसे याद रखोगे? I'll make it very easy. That's the head of the radius. ये head of the radius है. That's the neck of the radius. And what is this for the radius? The shaft of the radius. Head, neck, shaft of the radius. And what is this for the radius? The styloid process. So that's the head, that's the neck, that's the shaft of the radius, that's the styloid process. And what is this for the radius? Yes, what is this for the radius? The radial tuberosity. Can anyone tell me what is this muscle attached to the radial tuberosity? Yes, बच्चों, come on, answer this. इसमें बहुत सारे MCQs I'm trying to explain you. What is the muscle attached to the radial tuberosity? Yes, come on, answer students. Time is yours. Come on, answer. You get 2 minutes to answer this. Muscle attached to the radial tuberosity. Yes. Biceps brachii. Very good. That's a biceps brachii attached to the radial tuberosity. Fine. Now, what is this bone here? That's the ulna here. That's a dorsal aspect of the ulna, and that's a styloid process of ulna. Yes, styloid process of ulna. ये dorsal aspect है, dorsal aspect. Now, बच्चों, there's a muscle which begins from both radius and ulna. A muscle which begins from both radius and ulna. What is that? This is the abductor pollicis longus. Abductor pollicis longus. It begins from both radius and ulna. A muscle which begins from the radius alone. A muscle which begins from the radius is extensor pollicis brevis. Abductor pollicis longus and extensor pollicis brevis, they go together. ये दोनों साथ में जाते हैं. देखो ऐसे. What is this muscle? बस बच्चों ये slide याद रखना. This is very easy. There's a muscle which begins from the ulna. What is this muscle? Extensor pollicis longus. So muscle which begins from both radius and ulna, abductor pollicis longus. Muscle which begins from the radius, extensor pollicis brevis. Muscle which begins from the ulna, extensor pollicis longus. अब ये separately जाएगा. It goes separately. And students, what is this now? That's the anatomical snuff box. यही बन गया anatomical snuff box. So what is this boundary? Can anyone tell me what is this boundary of the snuff box? But show this boundary, lateral boundary. And the lateral boundary of the snuff box would be formed by two muscles. One, abductor pollicis longus and extensor pollicis brevis. Perfect. What is this boundary? Medial boundary. And this medial boundary would be formed by extensor pollicis longus. The floor, bachcho, the floor is formed by what? The floor is formed by the styloid process of radius and two carpal bones. ये कौन है? Scaphoid and trapezium. Scaphoid and ये है trapezium. This bone is trapezium. So styloid process of radius, scaphoid and trapezium. ये कहाँ होंगे? They are in the floor. They are in the floor of the snuff box. Now who's lying inside the snuff box? Snuff box के अंदर कौन होता है? Radial artery है ना? Radial artery is inside the snuff box. And if the radial artery lies on this bones, the radial artery will get compressed against this bones. अब क्या करोगे? There are two muscles, students. There are two tendons which are coming from humerus. ऊपर से आते हैं ये, and these two tendons are going to cover the bones like this. ये ऐसे bones को cover करते हैं. And what are these tendons of? Extensor carpi radialis longus and extensor carpi radialis brevis. So ये दोनों tendons कहाँ होंगे? Where will they lie? In the floor of the snuff box. So students, are you understanding this? The floor of the snuff box would be formed by styloid process of radius, the scaphoid, the trapezium. The floor is carpeted by, what is the carpet made by? Extensor carpi radialis longus and brevis. इसका content कौन है? Who's the content of the snuff box? Radial artery. And what is the roof of the snuff box formed by? Roof. Students, the roof of the snuff box is formed by? Yes, the cephalic vein. Or who lies in the roof? The cephalic vein and the superficial branch of radial nerve. Roof में कौन होता है? Cephalic vein and the superficial branch of radial nerve. I hope this is clear to all of you, students. समझ में आ रहा है ना ये? Content is radial artery and the roof is formed by the cephalic vein and the superficial branch of radial nerve. Is this clear, bachcho? Are you able to follow, my dear children? Yes? I'll show you one slide. Dekho. Just see the slide. Beautiful slide. This is beautiful. Appreciate this slide. So what is this? Just have a look at this. What is this area? Ye kya area hoga? That's the anatomical snuff box. Ye apna snuff box. So what is this boundary? Sorry, what is this boundary of the snuff box? Ye kya boundary hoga? This is the lateral boundary. And what's that? Medial boundary. So lateral boundary would be formed by what? Abductor pollicis longus and extensor pollicis brevis. And abductor pollicis longus and extensor pollicis brevis. The medial boundary would be formed by extensor pollicis longus. And you can see these two tendons in the floor. Ye dekho bachcho, this is ECRL and ECRB, right? And who's the content of the snuff box? Ye kaun hai? That's a radial artery. Radial artery. And what's this nerve in the roof? That's the superficial branch of radial nerve. Superficial branch of radial nerve. और कौन होता है इसके साथ? Who else is there? Cephalic vein. Cephalic vein and the superficial branch of radial nerve. Perfect. Okay, students. Very good, very good. Chalo, very nice. You are all answering very well, huh? Very good. You are all well prepared. So, ये एक revision है. This is a revision just before the exams. A quick brushing through. Chalo, bachcho. Come on, answer this. Number 5, claw hand is due to involvement of which of the following nerves? Come on, bachcho, answer this. Claw hand is due to involvement of which of the following nerves? Any guesses? Any guesses? Yes? Students, any guesses? Both. Very good, very good, very good. And you tell me, Khan? Yes. Med psycho? देखो मीडियन नर्व पैरालिसिस होता है, इंजरी होता है, क्लॉ हैंड होता है. अल्ना नर्व इंजरी होती है, क्लॉ हैंड होता है. If both median and ulnar nerves are damaged, you get a complete claw hand. Complete claw hand. Only median nerve damaged, only ulnar nerve damaged, you get a partial claw hand. I'll tell you. So the answer is both. You tell me which is the muscle paralyzed which leads to claw hand. ये बताइए. Which is that muscle which is responsible? हाँ, yes, very good. बच्चों बोलो. Which is the muscle which gets paralyzed, which results in claw hand, जिसकी वजह से claw hand होता है. Which is that muscle? Come on. समझ में आ रहा है ना what I'm asking? Are you following what I'm asking you? Okay, बच्चों, चलो, I'll ask you in the other way. What is this muscle? A, B, C, and D. ये जो muscle है ना, this muscle paralysis leads to claw hand. Yes, very good. P. That's lumbrical. Very nice, very nice. ये है lumbricals, है ना? These muscles are the lumbricals. You know, this is the first lumbrical, that's the second lumbrical, that's the third lumbrical, and that's the fourth lumbricals. Yes, very good. So, bachcho, if you can tell me, the first and the second lumbrical are supplied by which nerve? ये बोल सकते हो आप? The first and the second lumbricals are supplied by median nerve. Median nerve. The third and the fourth lumbricals are supplied by ulnar nerve. So first and second is median nerve. The third and the fourth is supplied by ulnar nerve. Right? So now, when this median nerve is paralyzed, when this median nerve is injured, the first and the second lumbricals are paralyzed. You get a claw hand like this. ये दो fingers का claw hand होता है. The first index and the middle finger का claw hand होगा. If the median nerve is injured, what do you call this as? Partial claw hand. Partial claw hand. If the ulnar nerve is injured, you get a claw hand of the third and the fourth digits. Third and the fourth digits. What do you call this as? Partial claw hand. है ना? And if both median and ulnar nerves are injured, you get a complete claw hand. This is what we call as a complete claw hand. Can anyone tell me which is that condition in which you get a complete claw hand. Yes, बच्चों बोलो. Yes, very good, Khan. Yes, very good, very good. Which is that condition? Which is that condition जिसमें complete claw hand होता है, जिसमें both median and ulnar nerves are involved, both median and ulnar nerves are damaged. वो कौन सा condition है? Come on बच्चों, answer. Come on. I'm waiting for you. I'm waiting for your answer. Which is that condition in which both median and ulnar nerves are injured? It's injury to the lower trunk of the brachial plexus. Injury to the lower trunk of brachial plexus. Injury to the lower trunk of the brachial plexus. क्या बोलते हो? What is that condition known as? What is that condition known as, बच्चों? The lower trunk of the brachial plexus. That is Klumpke's paralysis. Klumpke's. Eighth thumb deformity नहीं है बच्चा. Eighth thumb deformity नहीं है. Eighth thumb deformity is due to injury to the median nerve. Median nerve. मैं क्या पूछ रहा हूँ? What I'm asking you is, which is that condition in which both median and ulnar nerves are damaged? That's injury to the lower trunk of the brachial plexus. And this, when do we get? We get this in Klumpke's paralysis. Klumpke's paralysis. Am I clear? Erb's paralysis पता है ना आपको? Erb's paralysis is injury to which trunk of the brachial plexus? Upper trunk. And injury to the lower trunk में क्या होता है? Klumpke's paralysis, जिसमें median and ulnar nerves are injured and you get a complete claw hand. Fine, perfect, बच्चों, perfect. Okay. Right. So if the median nerve is injured, what do you get? अगर ये injury होता है तो you get a partial claw hand. And if both are injured, you get a complete claw hand. Complete claw hand. Yes, very good, very good. So we'll go to the next MCQ. Come on, bachcho, very good. You are doing very well. You are answering very well. Come on, going to the next MCQ, bachcho. While considering the femoral sheath and canal, which of the following statement is incorrect? The femoral sheath is continuous with the. Chalo, you answer this first. आपको क्या लगता है आंसर करना? Answer this. Come on, Khan. Come on, MD Psycho. Who else is there? PPP. और कौन है बच्चों? Short videos. Are you there, Anu Surgeon? हो ना सब लोग? Biju Menon. Divyank. Draw and paint. Yes. Chalo bachcho, come on, answer this. Any guesses to all of you? Yes? You tell me. Femoral sheath, anterior wall is formed by what? Anyone? Any guesses? The femoral sheath, anterior wall. Anterior wall of femoral sheath is formed by what? Posterior wall of femoral sheath is formed by what? चलो बोलिए बच्चों. ये सब MCQs हैं बच्चों. These are all very, very important MCQs. Yes, what are you saying? Following statement is incorrect. The femoral sheath contains femoral nerve. Very good, very good. You got that right. Yes. So बच्चों बोलो, anterior wall of femoral sheath is formed by what? Which fascia? Anterior wall of femoral sheath is formed by fascia transversalis. Fascia transversalis, correct? And the posterior wall of femoral sheath is formed by fascia iliaca. Fascia transversalis and fascia iliaca. Fascia lata नहीं है बच्चा. Fascia lata नहीं है. Fascia lata is the fascia which is going to enclose the thigh. ये thigh को surround करता है. It surrounds the thigh. That is known as fascia lata. Fascia lata is something different. And how is the femoral sheath formed, बच्चा? Femoral sheath के दो walls हैं, anterior and posterior wall. So anterior wall is formed by fascia transversalis. The posterior wall is formed by fascia iliaca. Perfect. Now, the femoral. Oh, look at this. This is beautiful. So what is this known as? ये है fascia transversalis, and that's the anterior wall of femoral sheath. And what is this muscle? Iliacus. And what is this? That's the fascia iliaca. Fascia iliaca. अब ये कौन है? That's the femoral sheath. That's the femoral sheath, students. So now you tell me, this femoral sheath has got three compartments. तीन compartments हैं. One is the lateral compartment, one is the lateral, one is the intermediate, and one is the medial compartment. Lateral, intermediate, and medial. Who lies in the lateral compartment? Students, a very important MCQ. Who lies in the lateral compartment is the femoral artery plus the femoral branch of femoral artery and the femoral branch of genitofemoral nerve. Femoral artery and the femoral branch of genitofemoral nerve in the lateral compartment. ठीक है? Who lies? Femoral artery plus femoral branch of genitofemoral nerve. Who lies in the intermediate compartment? That's the femoral vein. Intermediate compartment में क्या होता है? Femoral vein. And the medial compartment is empty. Students, what is this known as? इसे हम बोलते हैं femoral canal. Femoral canal, right? Yes, the upper part of the femoral canal. इसे क्या बोलते हैं? What is this known as? The femoral ring. Femoral ring. The upper part of the femoral canal is known as the femoral ring. Very good, very good. Medial, intermediate, and lateral. And what is this lymph node, बच्चों? Anyone can tell me what is this lymph node known as? एक lymph node होता है ना, which is going to close the femoral ring. Any guesses? What is that lymph node known as? This is the lymph node of Cloquet. That's the lymph node of Cloquet or Rosenmuller. Lymph node of Cloquet or Rosenmuller. And what does this drain? It drains. याद रखना, this is a very, very important MCQ. What is the lymph node of Cloquet or Rosenmuller drain? It drains the glans penis. It drains the glans penis and glans clitoris. ये याद रखना, हाँ. Lymph node of Cloquet or Rosenmuller, and what does it drain? It drains the glans penis and the glans clitoris. Okay, very good, very good. And you're answering very well. Yes, very good. देखो students, just understand this MCQ. अगर MCQ आता है penis और clitoris drains into, come on बच्चों, answer. Penis and clitoris drains into, your answer is the superficial inguinal lymph nodes. Superficial inguinal lymph nodes. ये याद रखना बच्चों. Penis and clitoris drains into. If this is the MCQ, your answer would be the superficial inguinal lymph nodes. But बच्चों, अगर MCQ है glans penis and the glans clitoris drains into, your answer is the deep inguinal lymph nodes, and that is lymph node of Cloquet. Clear है बच्चों? Is this clear to all of you? Perfect. ये बहुत इंपॉर्टेंट MCQ है. हाँ, anterior wall of femoral sheath, posterior wall of femoral sheath, तीन compartments, the contents of femoral sheath, the femoral ring, and who lies on the femoral ring? The lymph node of Cloquet. What does it drain? The glans penis and the glans clitoris. बस इतना याद रखिए. So what is the answer? The femoral sheath. See the option. While considering the femoral sheath and canal, which of the following statement is incorrect? The femoral sheath is continuous with the fascia transversalis. That's correct. Yes. It is continuous with the fascia transversalis. Which wall of femoral sheath? Anterior wall of femoral sheath. The femoral canal lies medial within the femoral sheath. Yes. The femoral canal is wider in females. What do you say, students? Right hai ki wrong hai? The femoral canal is wider in females. Yes. Why? Because the pelvis is wider in females and the blood vessels are small in size. Pelvis wide hota hai females mein, blood vessels are smaller in size, so automatically the femoral ring becomes wider in females. What is the importance of knowing this? Chances of femoral hernia are more common in females. Chances of femoral hernia are more common in females. Okay, that's clear. So what is the answer for this? Femoral nerve. Femoral nerve is outside the femoral sheath. ये याद रखना, femoral nerve is not inside the femoral sheath, it's outside the femoral sheath. Perfect, perfect. Very good. Come on, students, you're answering well. Come on. That's good. Identify the pointed structure. I'm not marked, I'm not given you the options, but if you can answer this. Identify the pointed structure. Chalo, boliye. Yes, Khan, answer. The rest of you, where are you all? Come on, answer. PPP. Med Psycho, come on. अगर wrong है तो there's no problem. I'm here to correct you. Yes, Menon. Short video surgeon कहाँ गए सब? चलो बच्चों आंसर. Yes, very good. That's sartorius. ये है sartorius. Very nice. This is the sartorius, the longest muscle in the body. है ना? The longest muscle in the body. बच्चों, can anyone tell me what is the action of sartorius on the hip joint? What is the action of sartorius on the knee joint? Can anyone tell this? Sartorius का action hip joint पे क्या होता है? What is the action of sartorius on the hip joint? It causes flexion, a very important MCQ again, flexion, abduction, and lateral rotation. Flexion, abduction, and lateral rotation at the hip joint. At the knee joint, what does it do? Flexion and medial rotation. Flexion and medial rotation at the knee joint. Yes, it is also known as a Taylor's muscle. Very good, very good. It is also known as a Taylor's muscle. Sartorius is also known as honeymoon muscle. So what is the action of sartorius on the hip joint? It causes flexion, it causes abduction, and it causes lateral rotation at the hip joint. And what is the action of sartorius on the knee joint, bachcho? It causes flexion and medial rotation at the knee joint. Sartorius is also known as a honeymoon muscle. It is also known as Taylor's muscle. Taylor's muscle. Taylor's muscle, honeymoon muscle, same. Action of sartorius. Perfect है students, बच्चों clear है? Can anyone tell me? I'll just put numbers for you. Number लगाता हूँ. You tell me what is this number 1, what is this number 2, and what is this number 3. Anyone? Any guesses? Come on. What is number 1? ये anterior compartment of thigh होता है ना बच्चा? Anterior compartment of thigh. So what is the muscle in the anterior compartment of thigh? What is that? One is rectus femoris. Rectus femoris. ये visuals हैं बच्चों. Visuals also you get in the MCQs. ये है rectus femoris. What is number 2? That's vastus medialis. Vastus medialis. What is number 3? Vastus lateralis. Vastus lateralis. Okay. So 1 is rectus femoris. 2 is vastus medialis. 3 is vastus lateralis. And ये क्या हो सकता है बच्चों? Can anyone tell me what is this muscle on the lateral side? I'll put this as number 4. ये कौन है? हाँ, very good, very good. 3 vastus नहीं, एक vastus नीचे होता है, एक vastus नीचे होता है. What is that number 4? That number 4 is the tensor fascia lata. Number 4 is the tensor fascia lata. Tensor fascia lata. Perfect. Okay. Which is the nerve supplying all these muscles? The nerves of the anterior compartment of the thigh. Any guesses? That's the femoral nerve. Femoral nerve. The nerve of the anterior compartment of the thigh is femoral nerve. Okay. Great. Bachcho, come on. Answer this. Obturator nerve supplies one of the following muscle. One of the following muscle. Yes. Answer this. Yes, very good, very good. You're answering very well. Come on, bacho, come on. You're answering very well. You're doing very good. Answer. Obturator nerve supplies one of the following muscle. वैसे बच्चों, tell me, thigh has got three compartments. तीन compartments है thigh में. One is the anterior compartment, one is the medial compartment, and one is the posterior compartment. We know this, है ना? Anterior compartment, medial compartment, and posterior compartment. So, which is the nerve of the anterior compartment? Nerve of the anterior compartment is femoral nerve. Femoral nerve. Which is the nerve of the medial compartment? Obturator nerve. Obturator nerve. And which is the nerve of the posterior compartment, bacha? Sciatic nerve. Nerve of the posterior compartment is sciatic nerve. Now, I'll just make a table for you. बस ये table याद रखना. Just remember what I'm telling you. All the MCQs will be clear. देखो, how do you remember this? Obturator nerve. And the obturator nerve has got two divisions. One is the anterior division and the other one is the posterior division. What does the anterior division supply? Anterior division supplies adductor longus, adductor brevis, pectineus, gracialis. Okay, so adductor longus, adductor brevis, pectineus, gracialis. The posterior division supplies adductor magnus, obturator, externus. Obturator externus. बस ये याद रखना. Just remember this table that I've given you. Obturator nerve. Can anyone tell me what is the root value of obturator nerve, bacha? Root value of obturator nerve? Yes. What is the root value of obturator nerve? Come on, answer this. It is L2, L3, L4. L2, L3, L4. Perfect, बच्चों, perfect. हाँ, अब आंसर करना. चलो. Obturator nerve supplies one of the following muscles. Your answer is adductor brevis. Adductor brevis. Gluteus medius nerve supply. Anyone? बच्चों. Very good. PPP. Very nice. Very nice. Obturator. Who supplies the gluteus medius? Gluteus medius is supplied by superior gluteal nerve. Superior gluteal nerve. Superior gluteal nerve तीन मसल सप्लाई करता है. एक है gluteus medius, gluteus minimus and tensor fascia lata. Tensor fascia lata. बस ये याद रखना students, this is extremely important MCQ. What is the superior gluteal nerve supply? The superior gluteal nerve supplies the gluteus medius, the gluteus minimus and the tensor fascia lata. Who supplies the sartorius? I just told you, femoral nerve. है ना? Sartorius who supplies? Femoral nerve. Adductor brevis who supplies? Obturator nerve. Obturator nerve का which division supplies the adductor brevis? Anterior division. And वो कौन सा muscle था which was supplied by the obturator nerve? That was obturator externus. Students, वो muscle है obturator externus. What is the nerve supply of obturator internus? It is the nerve 2 obturator internus. Nerve 2 obturator internus. It's a branch of sacral plexus. Nerve to obturator internus is a branch of sacral plexus. Chalo bachcho. Okay, very good. Come on, let us go to the next MCQ. Answer this. During dissection, students, during dissection, student identifies the femoral triangle. Fine. Below the inguinal ligament. On tracing below, he finds a small area lying on its medial aspect. the instructor addresses as the hunters or the subsartorial canal. The student identifies all the content in the canal except, in other words, yes, in other words, what are the contents of adductor canal? Contents of adductor canal. Students, come on, answer. Come on. So जहाँ पे femoral triangle end होता है, the area where the femoral triangle ends, we get a small canal which is known as the adductor canal. है ना बच्चा, adductor canal. So what are the contents of the adductor canal? I'll just make a slide for you. देखो हाँ, देखो. I'll just make a slide for you. A very easy way to represent your. देखो, ये femur है, ये femur है. This is the femur bone. That's a medial aspect and that's a lateral aspect. अब बच्चों, tell me what is this muscle on the medial side? You have vastus medialis. Come on, don't discuss in between. Don't talk in between. You answer to me. You discuss with me. Vastus medialis. ये क्या muscle होगा lateral side पे? Vastus lateralis. ठीक है? What is this muscle here? ये क्या था? Vastus intermedius. And what is this big muscle? Rectus femoris. ये anterior compartment of thigh है ना बच्चों. This is vastus medialis, vastus lateralis, vastus intermedius and rectus femoris. ठीक है. Now coming down, students, coming down. What is this muscle? Students, don't discuss among yourselves. This is adductor longus. And what is this muscle? This is adductor magnus. Adductor longus, adductor magnus. And what is this roof formed by? ये कौन है? That's the sartorius. What have I drawn for you, bachcho? What is this area known as? This area is known as the adductor canal. Adductor canal or the hunter's canal. Hunter's canal. And what are the boundaries of adductor canal? Therefore, who's above? Vastus medialis. Who's below? Adductor longus and adductor magnus. And the roof is formed by sartorius. What are the contents of the adductor canal? Contents of adductor canal. One is the femoral artery. Second is the femoral vein. And there are three nerves, bachcho. There are three nerves. One is the nerve to vastus medialis. The second is the nerve which is now becoming cutaneous. Yeah, अब cutaneous बनेगा. What's that? Saphenous nerve. And there's the posterior division of obturator nerve. I'll just mention this for you. ये लिख लेता हूं मैं. ये है femoral vessels. ये है saphenous nerve. That's nerve 2. Vastus medialis. And that's the posterior division of obturator nerve. Perfect. ये याद रखना. ये है adductor canal. I'll just show you one slide. I'll show you one printed slide also. Clear? So adductor canal के contents: femoral vessels. One is nerve to vastus medialis, the saphenous nerve, and the posterior division of obturator nerve. Fine, bachcho. I hope this is clear to all of you. Yes. So what is the answer for this? 1 minute. Just have a look at this slide. So the opposite side. You'll get confused. That's fine. Answer this MCQ. The instructor addresses as the hunter's canal. Student identifies all the content of this canal except femoral artery, yes. Saphenous nerve, yes. Posterior division of obturator nerve, yes. So what is not there? That's a nerve to vastus lateralis would not be there. ठीक है? Nerve to vastus lateralis नहीं होता है. What is the content of adductor canal? It's the nerve to vastus medialis. Dear students, I hope this is clear to all of you. Very good, very good. Med Psycho PPP, very good. Khan, very nice to all of you children. You're answering very well. Yes, have confidence in yourself and answer. Chalo, I will proceed then. Students will proceed. Identify this pointed structure. Identify the pointed structure. Any guesses? The pointed muscle. कोई guess कर सकते हैं? What is that pointed muscle? What is this? This arrow ये है. Arrow ये है. What is that pointed muscle? Which region are we looking into? ये क्या region देख रहे हो? This is the gluteal region, right? That's a gluteal region. What is this big muscle, बच्चों? What is this big muscle? That's a gluteus maximus, है ना? ये है gluteus maximus. This is the gluteus maximus, which is cut here. अब gluteus maximus को reflect किया. We've opened the gluteus maximus. Students, what is this pointed muscle? That's the gluteus medius. That's a gluteus medius. That's a gluteus medius, right? And now you tell me what is this muscle? That's a gluteus minimus. ये है gluteus minimus. What is this pear-shaped muscle? Piriformis, है ना? ये है piriformis. Clear, students? What is this nerve here? What is this nerve? Sciatic nerve. ये है sciatic nerve. Right? बस ये important muscles हैं, ये आपको याद रखने हैं. You get this as visual slide, students, so you have to be very clear about this. Students, can anyone tell me what is the action of gluteus maximus? Bas, just tell me the action of gluteus maximus. A very important MCQ. What is the action of gluteus maximus? It causes extension, abduction, and lateral rotation at the hip joint. Extension, abduction, and lateral rotation at the hip joint. And what is the action of gluteus medius? Gluteus medius does medial rotation. Gluteus medius does abduction. ये याद रखना बच्चों, this is very important. Gluteus medius does abduction and gluteus minimus does medial rotation. बस ये याद रखना. This is extremely important, students. Extremely important. So I'm trying to cover as much as possible. Jitna, whatever maximum I can cover, I'm trying to cover the important topics, the important MCQs. Students, clear? So gluteus maximus का action क्या होगा? Extension, abduction, and lateral rotation at the hip joint. Gluteus medius, abduction at the hip joint, and minimus causes medial rotation. Clear? At the hip joint. Come on, answer this. What are the structures? Which of the following structures pass through the greater sciatic foramen? Any guesses? Which of the following structures pass through the greater sciatic foramen? I'll just make a note of this for you. Now, what are the structures passing to the greater sciatic foramen? Just have a look. What is this foramen? That's a greater sciatic foramen. And ये क्या foramen होगा? That's a lesser sciatic foramen. Okay, that's a greater sciatic foramen, lesser sciatic foramen. So what are the structures passing through greater sciatic foramen? Greater sciatic foramen, say what are the structures passing? 1. Piriformis. If you know, you answer this, bacha. If you know, you answer this. Piriformis. Superior gluteal nerve and vessels. Superior gluteal nerves and vessels. Inferior gluteal nerve and vessels. Both. Nerve 2. quadratus femoris. Nerve to quadratus femoris. Posterior femoral nerve of thigh. Posterior femoral cutaneous nerve thigh. Yes, sciatic nerve बाकी हो गया, बाकी रह गया sciatic nerve. I just forgot the sciatic nerve. And then 7, 8, 9. इसे ऐसे याद रखना, pin structures, P-I-N, pin. So what is P, बच्चा? What is P? Pudendal nerve. Pudendal nerve. I is internal pudendal vessels. And what's N? That's N is nerve 2, obturator internus. That's nerve 2, obturator internus. Pin. Yes, Mohit, very good. These three structures, pin, enter, they get out through greater sciatic foramen. But they come out through the greater sciatic foramen and they enter the perineum through lesser sciatic foramen. They enter the perineum through the lesser sciatic foramen. Clear hai bacha? So what are the structures which enters the lesser sciatic foramen? Pin. The pin and a pin gets out through the greater sciatic foramen and then enters the lesser sciatic foramen. When they go into the lesser sciatic foramen, where do they enter? Into perineum. Perineum. And what gets out through the lesser sciatic foramen? So these are the structures which are getting out through the greater sciatic foramen. And which is the structure which gets out through lesser sciatic foramen. From the lesser sciatic foramen comes the tendon of obturator internus. Tendon of obturator internus. So what gets out through the lesser sciatic foramen? That's the tendon of obturator internus. मतलब ऐसे याद रखना, remember like this, three structures go inside the lesser sciatic foramen, one structure gets out through the lesser sciatic foramen. That's how you remember. Yeah? Okay, fine. Very good, very good, very good, students. Very nice. Chalo, come on. Answer the next MCQ. Which of the following statements best describes the contents of the anterior compartment of the thigh? Answer this. Which of the following statements best describes the contents of the anterior compartment of the thigh? Chalo, ek minute. I'll just make a slide for you, students. देखो, अगर ये फीमर है, that's a femur. Now, if this is medial, ये medial है and that's lateral. This is one septa here. Okay, एक minute. I'll just make the eye for you. That's a thigh. So what is this septa, bacha? What is this septa? This is one septa and this is one septa. So what is this? Medial intermuscular septum. Medial intermuscular septum. ये है lateral intermuscular septum. And ये क्या होगा? Posterior intermuscular septum. So the medial intermuscular, the lateral and the posterior intermuscular septum divides the thigh into three compartments. So tell me now, what is this compartment? Anterior compartment. What is this compartment? Medial compartment. And what is this? Posterior compartment. Posterior compartment. So who separates the anterior from the medial compartment, students? Anterior and the medial compartment को कौन separate करता है? The medial intermuscular septum. Are you getting this? Who separates the medial and the posterior compartments? The posterior intermuscular septum. And who separates the anterior and the posterior compartments? The lateral intermuscular septum. This is the easiest way to understand this, bacha. Easiest way to understand this. Clear? So see option 1. So anterior compartment of the thigh is separated from the posterior compartment by the anterior intermuscular septum. Anterior is separated from posterior by, look, ये anterior compartment है. The anterior compartment is separated from the posterior compartment by the lateral intermuscular septum. It's not the posterior intermuscular septum, it's the lateral intermuscular septum. Okay, fine. Which is the nerve of the anterior compartment? कोई बोल सकता है? Which is the nerve of the anterior compartment of the thigh? The nerve of the anterior compartment of the thigh is deep peroneal nerve. Deep peroneal nerve. And which is the artery of the anterior compartment of the thigh? The artery is anterior tibial artery. Anterior tibial artery. So the artery of the anterior compartment is the anterior tibial artery, and the nerve of the anterior compartment is the deep peroneal nerve. Okay? Chalo, answer this now. So option A is wrong. Option A is wrong. It is separated from the posterior compartment by the anterior intermuscular septum. No. It's the lateral intermuscular septum. All the muscles of the anterior compartment are innervated by superficial peroneal nerve. That's wrong, bacho. That's wrong. Which is the nerve here? That's a deep peroneal nerve. Deep peroneal nerve. Superficial peroneal nerve belongs to which compartment? Any guesses? Students. Superficial peroneal nerve belongs to which compartment? Lateral compartment. Superficial peroneal, lateral compartment nerve. The anterior tibial artery arises in the anterior compartment. That's wrong. The anterior tibial artery arises in posterior compartment. ये जो anterior tibial artery है ना, वो posterior compartment में arise होती है. And how does it go to the anterior compartment, student? It pierces the interosseous membrane. It pierces the interosseous membrane and goes to anterior compartment. Okay, so anterior tibial artery is a branch of popliteal artery. Remember this, popliteal artery के दो branches होते हैं. One is anterior tibial, one is posterior tibial. Clear है? So both of them are given in the posterior compartment. This anterior tibial pierces the interosseous membrane and then goes to the anterior compartment. It contains the peroneus tertius. Yes, that's correct. Peroneus tertius. Students, can anyone tell me what are the muscles in the anterior compartment? Muscles बोल सकता है कोई? Muscles in the anterior compartment of the thigh. 1. Tibialis anterior. Extensor hallucis longus. Extensor digitorum longus. Tibialis anterior. Extensor hallucis longus. Extensor digitorum longus. Peroneus tertius. Peroneus tertius. What is the action of all these muscles? Dorsiflexion at the ankle joint. इनका सबका एक्शन क्या होता है? Dorsiflexion. बच्चा, my dear child, रुचि. No. Sartorius is a muscle of thigh. Bachcha, it's a muscle of thigh, no? We are discussing the anterior compartment of the leg. Sartorius, yes, Sartorius does belong to the anterior compartment, but thigh. We are discussing the anterior compartment of the leg. उसमें muscles कौन है? Tibialis anterior, extensor hallucis longus, extensor digitorum longus, and peroneus tertius. Yes. Pavan Kumar. Right. Perfect to all of you. The anterior tibial artery arises in the posterior compartment. Okay, very good. ठीक है बच्चों, you make mistakes here. I'm here to correct you. But concept should be clear. So final tak you'll be very good to understand. Yes, come on, answer this. Number 14. Students, number 14. A 32-year-old male complains of severe pain. एक minute. Just tell me. I'll just show you the slide. ये देखिए. Can anyone identify this muscles here? What is this muscle? See this. ये muscle कौन है? Extensor hallucis longus. Extensor hallucis longus. What are these four tendons of? These are the four tendons of extensor digitorum longus. Extensor digitorum longus. What is this tendon of? That's the tendon of peroneus tertius. Peroneus tertius. ये कौन है? What are these tendons of? Number 1 and number 2. Number 1 is peroneus longus. Number 2 is peroneus brevis. Number 1 is peroneus longus. Number 2 is peroneus brevis. ये याद रखना बच्चों, this is very important है, ये visuals भी आते हैं, so be very clear with your theory concepts. The slides will be easy to understand. Clear? Okay, very good, very good. Come on students, going to the next MCQ for you. Identify this. Identify the pointed structure. Can anyone tell me what is this pointed structure? Pointed tendon. Which aspect of the leg is this, bacha? Which is this aspect of the leg? This is the medial aspect of the leg. Medial aspect of the leg of the foot. What is this? Medial malleolus. है ना? ये medial malleolus है. So this is the medial aspect of the foot. What is this tendon of? ये क्या tendon होता है? Tendoachilles. That's tendoachilles, right? Okay, students. What is this tendon of? I'll just put number 1, number 2, number 3. Number 1, number 2, number 3. Anyone? Tell me, what is number 1? 1 is tibialis posterior. 1 is tibialis posterior. Number 2, any guesses for number 2? Flexor. Yes, number 2 क्या होता है? Flexor hallucis longus. Number 3 is flexor digitorum longus. Flexor digitorum longus. So number 1 is tibialis posterior. Medial compartment है ये, so that's tibialis posterior. Tibialis posterior. Yes, very good, Mohit. Very good. Very nice, very nice. Please flexor hallucis longus. No, okay, there's a mistake here. Number 3 is going towards the great toe. Okay, so 3 is flexor hallucis longus. 2 is flexor digitorum longus. Yes, very good, Mohit. Very good. Is this clear, students? Fine to all of you? Chalo, we'll go to the next MCQ. Come on, students, come on, answer this MCQ. A 32-year-old male complains of severe pain along the lateral aspect of the thigh. To relieve pressure, the surgeon does a fasciotomy. All the following statements about this fascia are true except. Yes, come on. Now someone was answering this. What is the deep fascia of the thigh known as? Deep fascia of the thigh. Any guesses? The deep fascia of the thigh, it encloses the thigh. It surrounds the thigh like this. What is that deep fascia of the thigh known as? Fascia lata. Fascia lata. On the lateral side, this fascia lata splits. ऐसे split हो जाता है. It encloses a tract here. What is that tract on the lateral side known as? Yes, the iliotibial tract. Iliotibial tract. Dekho, I'll just make this like this for you. So that's the fascia lata. Except, except. Yeah, answer is B for this. B. So that's the fascia lata. This fascia lata on the lateral side, it splits into two here. The fascia lata divides into two, and this tract is known as the iliotibial tract. Iliotibial tract. Now this fascia lata, where is it inserted on? This fascia lata is inserted on the lateral condyle of tibia. It's attached to the lateral condyle of tibia. This is the iliotibial tract. So iliotibial tract क्या होता है? It is formed by the fascia lata. It is formed by the splitting up of the fascia lata, which are the muscles inserted into the iliotibial tract. There are two muscles. One is tensor fascia lata, and the second one is the gluteus maximus. So who's inserted into the iliotibial tract, students? There are two muscles inserted into the iliotibial tract. One is the tensor fascia lata, the muscle, and the second one is the gluteus maximus. So clear? What is igment? Again, I'll tell you again. What is this fascia lata? This fascia lata encloses the thigh. ये thigh को surround करेगा. It surrounds the thigh. On the lateral side, this fascia lata splits. And what is that tract known as iliotibial tract? So laterally, it encloses the iliotibial tract. Yes. Into this iliotibial tract, there are two muscles which are inserted. One is the gluteus maximus. Students, that's the gluteus maximus. And the second muscle is tensor fascia lata. Gluteus maximus and tensor fascia lata. Two muscles होते हैं. One moment. Okay. So gluteus medius नहीं होता. Also known as fascia lata, yes, inserted on the lateral condyle of tibia. That's correct. Perfect. Yeah, I'll proceed. Look at this, students, look at this. What is this? ये है अपना iliotibial tract. That's the iliotibial tract. What is this muscle here? That's the tensor fascia lata. That's a tensor fascia lata. And what is this muscle here? Gluteus maximus. And here, where is this iliotibial tract attached to? That's the lateral condyle of tibia. Perfect. Students, are you able to follow? All of you, are your concepts getting clear? Are you getting a good revision? Yes. So keep on answering. Okay, fine. Very good. Come on, you know this, students. You know this MCQ. You know this. Lymphatic drainage of glans penis is into which of the following lymph nodes? Come on, answer this. I just told you the glans penis and the glans clitoris, they drain into the lymph node of Cloquet or Rosenmuller. Correct? So that's a deep inguinal lymph nodes. Who drains into the para-aortic lymph nodes? Can anyone tell me? ये बहुत important MCQ है बच्चों. Para-aortic group of lymph nodes. Who drains? Any guesses? Come on, Khan, answer. Who drains into the para-aortic lymph nodes? Para-aortic. Any guesses? It's a testis and ovary. Testis and ovary, they drain into the para-aortic lymph nodes. Testis and ovary, Ruchi. It's testis and ovary which drains into the para-aortic lymph nodes. Lymphatics from the glans penis and the glans clitoris goes into the deep inguinal lymph node. That's a lymph node of Cloquet or Rosenmuller. Fine, bacha? Interiliac lymph nodes will receive all the organs. The uterus, the bladder, the rectum. This all will drain into the internal iliac group of lymph nodes. Perfect. Okay. Coming to the next MCQ. Come on, students, answer this. During dissection, a student finds an artery running on either sides of the sternum inside the thorax. He identifies it as the internal thoracic artery. All the following statements regarding this artery are correct except. Yes. Very good, Khan. Very good, Khan. So what is the answer for this, bacha? Come on, answer. Internal thoracic artery is a branch of first part of the subclavian artery. Correct. Internal thoracic artery, yes, it's a branch of first part of subclavian artery. It gives one anterior intercostal artery in each space. क्या बोलते हो? Is this statement correct or is it wrong? It gives one anterior intercostal artery is wrong. It gives two anterior intercostal arteries. It gives two anterior intercostal arteries in each space. Runs with a companion vein which drains into the brachiocephalic vein. Yes, that's correct. So internal thoracic artery runs with the internal thoracic vein, and the internal thoracic vein drains into the brachiocephalic vein. It drains into the brachiocephalic vein. Divides into a superior epigastric and musculophrenic arteries. That's correct. It divides into a superior epigastric and a musculophrenic artery. Okay, I'll show you this slide. I'll show you this. Have a look. Students, look how beautiful this is. Yes, come on, guess it. Try to understand. What is this artery? Yes, subclavian artery. That's a subclavian artery. And what is this muscle? ये कहाँ से देख रहे हो, students? Where are you looking this from? We have opened the thorax. You've opened the thorax and you're looking from inside the thorax. Thorax के अंदर से देख रहे हो. So you're looking at the anterior wall of thorax from inside. अंदर से देख रहे हो. Anterior wall of thorax, you're looking from inside, right? So what is this muscle? Scalenus anterior. This muscle is scalenus anterior. So which is this part of the subclavian artery, students? That's the first part, yes, second part, and that's the third part. So which is the muscle which divides the subclavian artery into three parts? That's the scalenus anterior. Can anyone tell me who divides the axillary artery into three parts? Any guesses? A muscle which divides the axillary artery into three parts. Yes, very good, Ruchika. The muscle which divides the axillary artery into three parts is pectoralis minor. Pectoralis minor. So what is this artery? This is the internal thoracic artery. Internal thoracic artery. And what is this vein which accompanies the internal thoracic artery? That's the internal thoracic vein. And this internal thoracic artery ends into two arteries. What is this? Musculophrenic superior epigastric. Scalenus anterior, deltoid नहीं है बच्चा, deltoid नहीं है. Scalenus anterior है, scalenus anterior. It's not deltoid, Ruchi. Clear to all of you? So that's about the internal thoracic artery. I'll just repeat this. And what are these arteries, students? What are these arteries? These are the anterior intercostal arteries. So how many anterior intercostal arteries are there? There are two anterior intercostal arteries. So look here once again. I'll just revise this. Internal thoracic artery is a branch of first part of the subclavian artery, correct? This internal thoracic artery accompanies the internal thoracic vein. The internal thoracic artery divides into two terminal branches, a superior epigastric and a musculophrenic. And it gives two anterior intercostal arteries in each space. That's it. Okay, I hope this is clear to all of you. Answer this, number 17. A 33-year-old patient is suffering from sudden occlusion at the origin of descending thoracic aorta. This condition would most likely decrease flow in which of the following intercostal arteries? Come on, answer this, bacho. Answer. What are the branches of descending thoracic aorta? If you know that, you'll understand this. Answer is lower 6 posterior intercostal arteries. Lower 6 posterior intercostal arteries. Look at this. Look at this. What are these? What is this? That's the aorta. Aorta. And what are these? These are the posterior intercostal arteries. So posterior intercostal arteries in the lower six spaces are branches of aorta. Posterior intercostal arteries in the lower six spaces are branches of descending thoracic aorta. In the upper two spaces, ये थोड़ा सा different है. ये थोड़ा सा different है. I'm telling you this. Don't write. I'm telling you. Look, understand this. Posterior. I'll write this for you. Posterior intercostal arteries in the lower spaces. This is important, bacha. In the lower spaces are branches of. In the lower spaces are branches of descending thoracic aorta. So in the lower spaces, these are branches of descending thoracic aorta. In the upper two spaces, the branches of, okay, in the upper two spaces, there are branches of superior intercostal artery, which is a branch of costocervical trunk, which is a branch of second part of subclavian artery, which is a branch of second part of subclavian artery. Just understand it like this, huh? Okay, students, is this clear to all of you? Yeah. I'll just repeat this for you. We are discussing the posterior intercostal arteries. Come on, students. Posterior intercostal arteries. Can you answer this? Posterior intercostal arteries in the lower spaces. थोड़ा सा difficult है ये. Posterior intercostal arteries in the lower spaces are branches of what? They are branches of the descending thoracic aorta. Clear? Posterior intercostal arteries in the lower spaces are branches of descending thoracic aorta. In the upper two spaces, they are branches of the superior intercostal artery, which is a branch of costocervical trunk, which is a branch of the second part of subclavian artery, a branch of second part of subclavian artery. Is this clear to all of you? Just one moment. Huh? Okay, fine. Okay, perfect. Come on, going to the next MCQ. Students, are you all following this? Are you all able to follow this? Come on, going to the next MCQ. See this. All the following veins drains into the azygous vein. Thorax के MCQs are थोड़ा सा difficult, slightly difficult they have. Students, come on, be with me, answer. All the following veins drains into the azygous vein except. Come on, students, answer. Any guesses? Any guesses? Any guesses? All the following veins drains into the azygous vein except. superior epigastric vein. Very good, Khan. Yes. Very good, very good, very good to all of you. So answer is superior epigastric vein. This is a very, very, very important MCQ. Ruchi, try to understand. I'll be drawing this. I'm drawing this for you. Yes, the rest of you, come on. Where are you? Come on, all of you. Answer. Keep on answering. Mohit. Khan. Yes, Khan is answering. Yes, very good. Pavan. Where are all of you? Amsa. PPP. Okay. Now look, I'll draw a slide for you, bacho. I'll draw a slide for you. One moment. Chalo. Look. Understand this. Understand this. A very important MCQ this is. What is this vein coming from the neck? Chalo bacho bolo, what is this vein coming from the neck? These are the internal jugular veins. Internal jugular vein. What is this vein which comes from the upper limb? That's a subclavian vein. Subclavian. So internal jugular and the subclavian vein joins to form the brachiocephalic vein. That's a right brachiocephalic. ये है left brachiocephalic. So internal jugular vein, ये है internal jugular vein, that's a subclavian vein, that's the brachiocephalic. The left is longer. Left brachiocephalic vein is longer. It joins with the right and forms what? SBC. ये बन गया SBC. And what is this vein which opens into the SBC? Yes, this is the azygous vein. बस ये slide याद रखना है आपको. Just remember the slide. That's the azygous vein. So now we are discussing the tributaries of azygous vein. Come on, students, answer this. The first right posterior intercostal vein drains into what? Yeah, first right posterior intercostal vein drains into the right. This is the brachiocephalic vein. Yeah, brachiocephalic vein. The first right posterior intercostal vein drains into right brachiocephalic. The first left posterior intercostal vein drains into left brachiocephalic vein. That means first, दोनों side पे first right posterior intercostal vein. These are the posterior intercostal vein. They drain into brachiocephalic vein. Second, third, and fourth. Second, third, and fourth. They join to form a vein here. इसका नाम क्या है? इसका नाम है right superior intercostal vein. And the right superior intercostal vein, how is it formed? It is formed by the joining of right, second, third, and fourth posterior intercostal veins. They join to form the right superior intercostal vein, and this drains into azygous vein. All the veins on the right side, they drain into what? Azygous vein. Second, third, and fourth on the left side. Students, second, third, and fourth on the left side joins to form a vein. इसका नाम क्या होगा? Left superior intercostal vein. And this left superior intercostal vein drains into the left brachiocephalic vein. Left brachiocephalic. 5, 6, 7, and 8. Students, 5, 6, 7, and 8, they join to form a vein here. And this vein drains into azygous vein. इसका नाम क्या है बच्चों? Any guesses? This is the accessory hemiazygous. Accessory hemiazygous. 9, 10, 11, and 12. They join to form a vein, and this is the hemiazygous. Accessory hemiazygous and hemiazygous. Be very clear about this. ये MCQs आते हैं बच्चों. These are all asked as MCQ. But look, the MCQ comes like this. The first right posterior intercostal vein drains into, your answer, the right brachiocephalic vein. The first left posterior intercostal vein drains into left brachiocephalic. Second, third, and fourth on the right side, they join to form the right superior intercostal vein, drains into azygous vein. Second, third, and fourth on the left side joins to form the left superior intercostal vein, drains into left brachiocephalic. On the right side, all the veins would drain into azygous vein. On the left side, 5, 6, 7, 8 joins to form the accessory hemiazygous. 9, 10, 11, 12 joins to form the hemiazygous. Both of them would drain into azygous vein. Perfect. Perfect. Very good, students. You are answering very well. Yes. So, इसका आंसर क्या होगा? All the following vein drains into azygous vein except the superior epigastric. Posterior intercostal, yes. Hemiazygous, yes. Right superior intercostal, yes. Clear to all of you, बच्चों? Clear है? Very good, very good, very good. Come on, come on, come on. Coming to the next MCQ, students. A 32-year-old soldier received a wound in the neck during the Kargil war. Recently, during physical examination, it was noticed that whenever he blew his nose or sneezed, the skin over the right clavicle bulged upwards. This could be explained by. Come on, answer this. Answer this. Any guesses? Bachcho, any guesses, my dear children? देखो, I'll make it easy. ये दो lungs है. देखो बच्चों, ये दो lungs है. These are the two lungs like this. The heart is here in between. So what is this part of the lung? ऊपर. What is this part of the lung known as? Apex. What is this below? Base. ये heart है. यहाँ पे there's a heart here. So what is this surface known as? Mediastinal surface. The ribs here. So what is this surface known as? Costal surface. So apex, base, mediastinal surface, costal surface. Fine. Now, this apex of the lung comes at the root of the neck. यहाँ पे आ जाता है. It comes at the root of the neck. And this apex of the lung is covered by a fascia. It is covered by a membrane. What is that membrane known as? The suprapleural membrane. Suprapleural membrane. तो ये suprapleural membrane क्या होता है? What is this suprapleural membrane? It covers the apex of the lung. And you know, when we breathe in, does the lung come up? Yo, do you find a bulge here? No. We don't find a bulge here, no, at the root of the neck. Why? Because ये जो suprapleural membrane है ना, that prevents the lung from bulging up at the root of the neck. If this suprapleural membrane is damaged, you will see the bulging of the lung at the root of the neck. Understanding? So that is suprapleural membrane. So apex of the lung is covered by the suprapleural membrane. Yeah, the answer is damage to the suprapleural membrane. Okay, students, can you tell me this? Pleura is of two types. One is the parietal and one is visceral. Parietal and visceral. Okay. So parietal pleura is of four types. ये बता सकते हो आप? Parietal pleura is of four types. You have to know the nerve supply of parietal pleura. This is what is asked in the MCQs. Parietal pleura is of four types. One, come on बच्चों, answer. Mediastinal. Second, diaphragmatic. मतलब जो mediastinal surface of the lung को cover करेगा, that's mediastinal pleura. The one which covers the diaphragmatic surface of the lung, that's a diaphragmatic pleura. Costal. And the fourth one is cervical. Costal and cervical pleura. Right. But show, I want the nerve supply. Can anyone tell me what is the nerve supply of mediastinal and diaphragmatic pleura and what is the nerve supply of costal and cervical pleura? Intercostal nerves. Iska nerve supply? Intercostal nerves. Yes, very good, bachcho, very good. And what is the nerve supply of mediastinal and diaphragmatic pleura? Come on, if you answer this, come on. This is very important. Yes, Khan, what is the nerve supply of mediastinal and diaphragmatic pleura? Yes, PPP. Ruchi. Mohit kahan gaya? Where's Mohit? This is supplied by phrenic nerve. You should know this, bacha. You should know this. This is supplied by phrenic nerve. Yes. And can anyone tell me what's the root value of phrenic nerve, students? It is C3, C4 and C5. The root value of phrenic nerve is C3, C4, C5. So parietal pleura is of four types. And I have told you the nerve supply. And visceral pleura ka nerve supply kya hota hai? Sympathetics and parasympathetics. This is autonomic nervous system. This is autonomic nervous system. Okay, perfect. Can anyone tell me What is the answer for this? Left anterior descending artery is a branch of. Come on, students. Any guesses? Left anterior descending artery is a branch of. Yes, left anterior descending artery is a branch of left coronary artery. It's a branch of left coronary artery. So the left coronary artery, yes, very good, very good. Be confident, Ruchi, be confident. You know things. Be confident. The question mark lagate ho, matlab you're not confident. You should be confident. Okay. So look, left coronary artery के branches क्या होंगे? There are two main branches. One is the left anterior descending branch. The second one is circumflex branch. है ना? The second one is the circumflex branch of the left coronary artery. Circumflex branch, right? Then फिर वो बाकी branches देते हैं. Yes. The rest are the marginal branches. Marginal branch. If there are branches to SA node, AV node, that is all fine. Okay. Diagonal branches, yes. Diagonal branches. Okay. So left anterior descending is a branch of left coronary artery. Ascending aorta. And the coronary arteries are branches of what, bachcho? What are the branches of coronary artery? I mean, the coronary arteries itself are branches of what? Can anyone tell me this? Ye dekho. This is the ascending aorta. That's a arch and that's a descending aorta. ठीक है ना? ये होंगे branches from the arch. What are the branches from the arch of aorta? That's the brachiocephalic artery or the brachiocephalic trunk. Brachiocephalic trunk. Yes, very good, very good, very good. What is this? This is the left common carotid. That's the left subclavian artery. The ascending aorta shows two dilatations. What are these dilatations known as? Aortic sinus, and this aortic sinuses will give origin to the left and the right coronary arteries. Left and right coronary arteries. Very good. So ascending aorta gives origin to coronary arteries. The arch of the aorta से तीन branches आते हैं: the brachiocephalic trunk, the left common carotid, and the left subclavian. And the descending thoracic aorta gives, what are these arteries, bachcho? What are these arteries? These are the posterior intercostal arteries in lower spaces. Posterior intercostal arteries in the lower spaces. ये है arch, descending. Okay, fine. Students will proceed. Come on, come on, come on. We'll proceed. Can you answer this? What is this pointed structure? What is this pointed structure? Come on. Students, answer. Any guesses? This pointed structure is the right coronary artery. That's the right coronary artery. What is this artery? That's left anterior descending. Left anterior descending. What is this? This is the. No, that's not SVC. Yes, VCI. This is the pulmonary trunk. That's the ascending aorta. Dear to all of you, this is the right atrium, that's the right ventricle, and that's the left ventricle. Okay, fine students, very good. Very good to all of you, very good, very good. So the pointed structure is the right coronary artery, and I've labeled the rest of the things. Okay. Pulmonary trunk, ascending aorta, and the SVC. Hello, very good, very good. Answer this. While studying the mediastinal surface of the right lung, a first prof student notices a vein over its hilum. So, students, in other words, which is the structure which arches over the hilum of the right lung? That's the MCQ that you have to understand. He identifies it as azygous vein. So the structure which arches over the hilum of right lung is azygous vein. He further traces this vein and finds its opening into. Come on, answer this. Where does the azygous vein open into? We've just seen that, no students. Upon the draw kiya, we've just drawn that. It drains into SVC. It drains into the SVC. Azygous vein opens into SVC. Correct? Answer this. What is this structure which arches over the hilum of the right lung? That's a azygous vein. अगर ये azygous vein है, what is this impression form? SVC. If that's the SVC, what is this impression form? Right atrium. So what is this impression form? IVC. Students, following this. So these are the impressions on the mediastinal surface of the right lung. Impressions on the mediastinal surface of the right lung. Okay. Azygous vein, SVC, right atrium, IVC. And what is this? What is this lung? That's the left lung. And the structures which arches over the hilum of the left lung is the arch of aorta. What is this? That's the left ventricle. Left ventricle. Dear students, so I'll just make this for you. We'll write it like this. Structure which arches over hilum of right lung, left lung. On the hilum of right lung, what is that? Azygous vein. Left lung is arch of aorta. Okay. That's one more MCQ. Nerve in front of hilum, behind the hilum. Hello students, if you can answer this. Nerve in front of the hilum. Any guesses? Any guesses? मतलब ये है ना, हाइलम के आगे एक नर्व होती है, हाइलम के आगे एक नर्व होती है, and hilum के पीछे एक नर्व होती है. Can anyone tell me what are these two nerves? Come on students, come on, you can answer this. Come on. There's a nerve in front of the hilum. Any guesses? Okay, Khan, that's fine, bacha, that's okay. That's good. Telling me structures at the hilum. I'm asking you which is a nerve in front of the hilum and which is the nerve behind the hilum. Anyone? The nerve in front of the hilum is phrenic. ये याद रखना बच्चों. And the nerve behind the hilum is vagus. In front of the hilum is phrenic nerve and behind the hilum is vagus nerve. Very good, Himanshu. Yes, you got this right. Very good. Very good, PPP. Right. So we'll proceed to the next MCQ. Now you can answer this. Come on, bacho. Which of the following structures are related to the mediastinal surface of the right lung? Answer this. We've just seen this. Which of the following structures are related to the mediastinal surface of right lung? Kya bolte ho? Now answer. You know this. We've just seen this. Structures related to the mediastinal surface of the right lung. Yes, we see. Yes. Azygous vein, yes. Phrenic nerve, yes, in front of the hilum. Hilum ke upar is the azygous vein. So what is the answer? It's the left ventricle. Left ventricle. Who's related to the mediastinal surface of the right lung? It's the right atrium, right ventricle. Right ventricle. Okay, fine. Clear to all of you. Okay. We go to the next MCQ. So answer this. Answer this first. Diaphragm. 656. No. Answer this. Diaphragm is a muscular structure separating the thoracic and the abdominal cavities. One of the following structure does not pass through the aortic hiatus of the diaphragm. Come on, answer this, students. This is very important. So there are three major openings in the diaphragm at T8 vertebral level. T8 vertebral level, what passes through the diaphragm is IVC and right phrenic nerve. T10, esophagus with right and left vagus. T12 is aorta, azygous vein, thoracic duct. Answer is hemiazygous vein for this. Clear to all of you, students? Is everything clear to all of you, my dear children? So there are three major openings in the diaphragm. One is at T8 level, T10 and T12. T8 what opens is IVC and the right phrenic nerve. T10 esophagus with the right and left vagus. And T12 is the aorta, azygous vein and the thoracic duct. Okay, students, I hope everything is clear to all of you. So we've discussed the first half of this topics today. 2 hours. I've got one more session to be discussed. One more session to be discussed, and this will be discussing on Thursday. Okay. The second session of anatomy would be on Thursday. Any doubts you have till here, bacho? Do let me know. Any doubts you have till here? So it's 6:59. I'm not going for a new MCQ now. Any doubts? Everything is clear. Just revise everything and come. I'm trying to, revise as many topics as possible, trying to make you aware of all the important topics which are asked in the MCQs. Clear to all of you, students? I hope everything is clear to all of you. Thank you to all of you for the patient listening. Thank you. Thank you to all of you. Yes. Okay, we'll stop here. अभी तक कुछ update नहीं आया बच्चा. There's no update as such. Any update comes, we'll let you know immediately. We'll let you know. Okay.